Zolpidem is used for a short time to treat a certain sleep problem, insomnia, in adults. It helps you fall asleep faster and stay asleep longer, so you can get a better night's sleep. It may also reduce the number of times you wake up during the night. Zolpidem belongs to a class of drugs called sedative-hypnotics. It acts on your brain to produce a calming effect. Before taking Ambien CR, make sure to read the medication guide provided by your pharmacist. Take the medication by mouth on an empty stomach, usually once a night. Swallow the tablets whole and do not crush or chew them. Don't take a dose unless you have time for a full night's sleep of at least 7 to 8 hours, and do not exceed the prescribed dosage. If you suddenly stop using this medication, you may have withdrawal symptoms, so your doctor may lower your dose slowly. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk of addiction. If you have trouble sleeping after stopping the medication, contact your doctor. If you feel dizzy, tell your doctor or pharmacist right away. This medication may make you feel sleepy during the day, so let your doctor know if you experience daytime drowsiness. Remember, your doctor prescribed this medication because they believe the benefit outweighs the risk of side effects. However, if you experience a memory loss, changes in mood or behavior, or any serious side effects, contact your doctor immediately. While serious allergic reactions are rare, seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects, contact your doctor or pharmacist. If you're in the US, call your doctor for medical advice or report side effects to the FDA. In Canada, call your doctor for medical advice or report side effects to Health Canada. There have been rare occasions where people taking Ambien CR have engaged in activities such as driving, sleepwalking, preparing food, making phone calls, or having sex while not fully awake. Often, these individuals do not remember these events. If you experience any of these activities after taking this medication, it is important to inform your doctor immediately. It is also advised to avoid taking similar medications if you have had this reaction to the medication. Before taking Ambien CR, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Also, it's important to tell your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, mental/mood problems, a history of substance use disorder, sleepwalking, lung/breathing problems, or a certain muscle disease. After taking Ambien CR, avoid driving, using machinery, or doing any activities that require clear thinking. You may feel alert, but this medication can continue to affect your thinking, making these activities unsafe. It can also increase the risk of falls and cause dizziness or blurred/double vision. Avoid alcohol or marijuana, as they can make you more dizzy or drowsy. Be aware that children may be more sensitive to the side effects of this drug, especially dizziness and hallucinations. Older adults may also be more sensitive, experiencing dizziness, confusion, unsteadiness, and excessive drowsiness, increasing the risk of falling. If you're pregnant, use this medication only when clearly needed, as it may have potential risks for the baby. Similarly, a small amount of this medication passes into breast milk and may have undesirable effects on a nursing infant. Discuss all these concerns with your doctor. It's important to be aware of potential drug interactions with Ambien CR. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Certain medications, such as sodium oxybate, can interact with Ambien CR. Other drugs, like azole antifungals, rifampin, and St. John's wort, can affect how Ambien CR works in your body. Taking Ambien CR with other products that cause drowsiness or breathing problems, such as opioid pain relievers or muscle relaxants, may increase the risk of serious side effects. Be sure to check the labels on all your medicines and ask your pharmacist about using them safely. If you suspect someone has taken too much Ambien CR and they are having trouble breathing or have passed out, call 911 immediately. Otherwise, contact your local poison control center. Symptoms of an overdose can include slowed breathing or being in a deep sleep from which they cannot be woken up. It is important not to share Ambien CR with others because it is against the law. As you age, your sleep pattern may change and you may experience interruptions in your sleep. It is recommended to consult with your doctor or pharmacist for ways to improve your sleep without medication, such as avoiding caffeine and alcohol close to bedtime, avoiding daytime naps, and going to bed at the same time each night. If you forget to take a dose, wait until you have a full 7 to 8 hours to sleep before taking the next one. You should store Ambien CR at room temperature, away from light and moisture. Don't keep it in the bathroom, and make sure to keep it away from children and pets. When it's expired or no longer needed, you can properly discard it, but don't flush it down the toilet or pour it into a drain unless you're told to do so. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.